Hi everyone, it's Rachel here from North Brisbane Psychologists. I'm here without Alexis today because she has a family gathering, and I'm also about to go out myself to watch my oldest child perform music at a venue in the West End area of Brisbane. But I thought I have a little bit of time, so I'm going to do a live stream on my own to talk about a topic I'm covering tomorrow with a bunch of general practitioners as part of a doctor's visit. And that is, well, I'm talking with the doctors about ADHD, and I thought I'd talk, so it's in my mind, and I thought I'd talk more generally about neurodivergence and because this term's only come into the common lexicon in maybe the last 5 years, and it was a term, neurodiversity and neurodivergence was a term or terms coined around the turn of the century, around 99-2000, by a sociologist, actually not a psychologist, called Judy Singer. And there's a few things I want to say about neurodiversity and neurodivergence. And then I might talk a bit more about ADHD, but I'll keep my eye on the questions. And if there's anybody asking questions about ASD, I'm happy to answer those as well. So, first of all, I'd like to point out that this is not an area of specialty for me, although I do supervise colleagues who do specialise in treating child and adult ADHD and ASD. So, if you're not sure what those terms mean, ADHD is attention deficit hyperactivity disorder, and ASD is autistic spectrum disorder. But neurodivergence can also include disorders that are less common, such as Tourette's syndrome, sensory processing disorders, dyslexia, because all of these are brain-based disorders that have strong genetic factors, genetic risk factors, so they often show up quite early in life. So they're not mental health conditions per se, they're neurodevelopmental conditions, so they're very brain-based. But of course, the environment very much shapes how these disorders, which is not a word I like, but anyway, it's there in the language. The environment shapes how these disorders manifest and the degree to which they cause struggle and suffering for the individual. So this is what we mean by neurodivergent. And neurodivergent means in the individual, the brain, and neurodiversity is in the population. People often confuse them. Neurodiversity is a bunch of people who have kind of different brains from the normal or typical brain, which I didn't used to think was a thing, but it kind of is a thing. The neurotypical brain, the normal brain, is kind of better at a couple of things. Better at self-regulating stress and emotion, and the neurotypical brain is also better at picking up on unwritten social cues and kind of figuring out how to fit in or figuring out how to relate to people, whereas neurodiverse people can struggle with self-regulation and with social cues and social rules in certain ways. And it's not their fault, of course. I have 3 kids, 2 of them have diagnoses, the younger one with ADHD and ASD and the older one with ASD. So like I said, I'm not an expert, but I work with experts and I have got neurodivergent kids. So let me tell you a couple of things about ADHD, and I'll bring in ASD in amongst this as well. So for anyone who's not sure whether they maybe know people with ADHD who are undiagnosed, or if you have kids who you work with or parent, what are we looking out for? Well, the checklist I've got here in front of me is actually a checklist for adult ADHD, which I'm giving to these doctors tomorrow, but we see this in kids as well, and adults with autism or ADHD had to have it as kids for it to be that diagnosis. This is not something we develop in adulthood. It's just that if it gets diagnosed in adulthood, it means it wasn't diagnosed in childhood. So with ADHD, we're looking at behaviors that are impulsive. We're looking at disorganization and difficulties with prioritizing, difficulty finishing tasks. See, this is already sounding a bit like me. Poor time management skills. I'm not too bad. Problems focusing. Trouble multitasking. Excessive restlessness. You see things like fidgeting. poor planning, low frustration tolerance. This is a big one I see in adult ADHD. Frequent mood swings, hot temper, and trouble coping with stress. Now, the thing is, we can see those behaviors in ourselves and others, and psychologists see these behaviors sometimes in clients. It doesn't mean they've got ADHD. Like I said before, at least some of these symptoms need to have been present in childhood. Otherwise, if there were no symptoms present earlier in life, we have to screen for other disorders, as these can also be behaviors associated with anxiety, depression, personality disorders. What we see in adults with ADHD is that their hyperactivity goes down by the time they reach adulthood, but they still may struggle with attention, so paying attention, staying focused, keeping track of their thinking, track of their tasks. We may still see impulsive behaviors or restlessness, and there's 3 subtypes. That was the other thing I wanted to say about ADHD. There are 3 subtypes. So there's the inattentive subtype. We see this in children and adults, and we see that one more in female clients, the inattentive subtype. So, difficulty, these are often people who have trouble with study, and they may be highly intelligent. I can think of some of my clients, very smart, but really have a lot of trouble focusing and tracking their own tasks, their own behaviors, difficulty managing their attention. This is why attention is the first word of ADHD. Psychiatrists many decades ago noticed that some people really struggle to stay on task and struggle to stay organized and remember things and complete things. So the inattentive subtype doesn't have the same degree of impulsivity and hyperactivity. Then we get the impulsive subtype. So these folk might be quite good at paying attention, but they're really impulsive. And then we get the combination, so people who struggle with both, which is very difficult if you struggle with inattentiveness and impulsivity. And we often see the combined subtype and the impulsive subtype in male clients. Now, the thing about ADHD, as with ASD, is we often see co-occurring difficulties or disorders. So they actually often go together. It's not uncommon for ASD and ADHD to both be diagnosed in an individual who really struggles with their emotions socially, and perhaps with anxiety. And we also often see anxiety, sometimes depression. And I've met clients who also have a neurodiverse brain and bipolar or some other mood disorder. So, it's really interesting. We're taught, and I'm going to be teaching these doctors tomorrow, we're not really treating the ADHD or the ASD. A neurodivergent brain is a neurodivergent brain, and we have to learn to love our brains and live with them and manage them. But what can happen is anxiety, depression, and other mental health struggles are common for people with neurodiverse brains because it's hard. Life is hard, and it's a bit chicken and egg. If these individuals struggle at school, socially and or academically, that can affect their self-esteem, which affects their mental health, which then affects their behavior, which then makes it more difficult to maintain friendships, which then affects their mental health, and it becomes like a vicious cycle, a chicken and egg sort of cycle. So when we see clients with ADHD or ASD, we don't treat the ASD or the ADHD per se, although we want to inform and educate ourselves about it as mental health practitioners so that we have a compassionate lens through which to see these people, and so they may see themselves through that lens of science, of understanding, and of compassion. So it's been really liberating for some of my clients in the past when together we've come up with a diagnosis and they've said, oh my goodness, I feel so good. My life makes so much sense now. I'm not crazy. I'm not a terrible person. I just have autism, or I just have ADHD. So there are some screening tests that we use, and actually they're publicly available. If you Google if you're interested in adult neurodivergence, then you can Google adult ADHD screener PDF, and you'll find the something called the ASRS. That's very easily available, and it stands for Adult ADHD Self-Report Scale, ASRS. And there's something called the ASQ, Autism Screening Quotient, I think that stands for. It's another screening tool for autism. And these are ones psychologists use, but you can find them on the web, and it might be something you do and then take to your doctor or your psychologist if you're interested in a diagnosis. You know, they're one page questionnaires. Okay, so I just wanted to take any questions that people might have about neurodivergence, how to live with it, how to understand it better, because I do think the first step is understanding. Thank you, Libby. Libby's posted a link to the ASRS, which is the Adult ADHD Self-Report Scale, the symptom checklist. Thank you so much. Yeah, and it's so self-explanatory. You don't have to be a psychologist to use it. You just have to read the first page and fill out the second page, and it's self-scoring, which means you can understand what it means for yourself. But of course, you can't diagnose yourself. Even psychologists and doctors who have a diagnosis of some kind of neurodivergence, they need to go to someone else to get the diagnosis. So you could take that questionnaire that Libby posted along to a doctor or psychologist. Libby asks, are they always treated with medication or not? I'm so glad you brought up medication, because it was on the other side of my bit of paper here to talk about. So here's what I've noticed with, let me talk about the ADHD folk first. So I mainly work with adults, and when I've seen adults eventually get a psychiatrist appointment, as we all know, psychiatrists are very heavily booked up. If they get a diagnosis, sometimes I'll write them a letter saying, look, I think a diagnosis is warranted here, but I can't prescribe medication. So if they take something like Ritalin, which most of you would have heard of, or Vyvanse or Concerta, these are other ADHD medications, often they work really well at first. For anyone who truly does have ADHD, the medications will make a difference. Always some side effects with any medication, can take a couple of weeks to adjust, get the right dose, all of that. And then for 5, 6, 7, 9 months, my clients will tell me, this is life-changing. I can focus on my studies. I can focus at work and get more done. I feel more relaxed, which is funny because ADHD medications are a form of amphetamines, which kind of stimulate the nervous system, but somehow they actually regulate the nervous system of people with ADHD. And then the brain adapts. So that we know with antidepressants, which block the synapses in our brain cells, the cells themselves in our brain grow new dendrites. So you can look that up. I won't take up our time with that. But there's new research that shows with antidepressants, eventually the brain cells that are affected by this medication will adapt by growing extra dendrites, which is part of an explanation as to why the efficacy of these medications decreases over time. And the same I've noticed with ADHD medications. So I had a client last week who said to me, I've been on this medication 2 years now and it's not working as well as it did in the beginning. And this seems to be very common because our brains want to return to some sort of homeostasis, and our brains are like, hey, what are you doing to me? You know? And our brains are amazing. So we can't rely just on medication. We do need to, find coping strategies in life. I'm not for or against medication. I have neurodivergent clients who are unmedicated and neurodivergent clients who are medicated, some who've gone off, some who've never tried them. So it's really up to each individual, but it's no big deal if people do want to try them. I haven't seen any more questions come through yet. I'm so glad you prompted me with that question though, Libby. People often ask, and I know the doctors are going to ask me tomorrow, what can you do? Well, given that many folk with ADHD, and this is also true for people with ASD, struggle with impulsivity, doing without thinking, speaking without thinking, It's only one thing they struggle with, but it can be a thing they struggle with. We need to practice the pause, and this needs to be a practice, like brushing our teeth. We never get to stop. We have to do it all the time until we're very, very old. You know, there's that famous Viktor Frankl quote that says, between the stimulus and response is a gap, and in that gap lies our choice. So it really is finding the pause, slowing down. So any mindfulness-based practice that works for you, and there are many of them. There's yoga, there's the Alexander technique, there's non-linear movement, there's all sorts of meditation and breathwork techniques. These are highly recommended for neurodivergent folk because their nervous system seems to idle a bit higher than the rest of us. And, you know, the rest of us struggle too sometimes, right? And so, actually, I've got a client who uses the Alexander technique. You can Google that. My oldest child who has autism, she had a couple of years worth of Alexander technique lessons, which is a technique, you can Google it, for moving the body and the breath quite deliberately. So it's very much a mindfulness practice. Libby says, is it considered genetic? There are strong genetic risk factors for ASD and ADHD, much more so than for other mental health conditions. So if you take a family tree, and people obviously don't know often whether their uncle or auntie or grandparent or whatever had it because it wasn't very widely diagnosed until, 20 years ago. But, just looking at some of the behaviors, once you understand neurodivergence, you see it in families, you see it in the grandparents, you see it in the great-grandparents, you see it in uncles and aunties, and when two neurodivergent folk get together, not surprisingly, they very often have a neurodivergent kitty. So strong genetic risk factors there for ASD and ADHD, very strong. Kim says, can you talk about your experience of any medication options when the person has high blood pressure? The non-stimulant medications. I wish I could, Kim, but not being a medical doctor, I don't want to talk to that. I know there are, that's a question for your doctor. I know there are some neurodivergent clients I have who do well on SSRIs, and I'm not sure if which are antidepressants, I'm not sure if they increase blood pressure. And of course there's many naturopathic medications, and Alexis is not here to talk about that. But even if we find prescription or natural medication that really helps with nervous system downregulation or helps with concentration, we still need all the behavioral strategies, and as well as lots of mindfulness practices that are very much required for neurodiverse folk. There are, I get my clients to use their phone, use technology to set reminders, really make use of those apps like Todoist, or even the Reminders app on the phone, and the calendar app, to set alarms, set reminders, because ADHD folk can be quite forgetful and disorganized. And so we can really use lists and apps and technology to, hack our own brains. So there is such a thing as ADHD coaching. A couple of our psychologists do it. I haven't been trained in ADHD coaching, but it's called coaching because it's very much about, okay, I'm going to help you get your life in order. I'm going to help you with time management. It's very skills-based. That's why it's called coaching. So if you're interested in ADHD coaching, you can give us a call or send us a private message here on Facebook, and we can hook you or your loved one up with an ADHD coaching practitioner. Kim says, I mean to ask about non-stimulant medications. Can that benefit some ADHD brains? Well, antidepressants are non-stimulant medications, and they can help some people with ADHD. What else? There are some herbs and herbal medicines like NAC, which I know benefited a couple of my clients. NAC, N-A-C, I can't remember what it stands for. N-acetylcysteine. I can't remember what the A stands for. I take NAC as well. I take a few herbal medications like ashwagandha because I feel like they do support my nervous system, and anything that supports your nervous system should hopefully support down regulation, which ADHD folk need, and often ASD folk need that as well. Also, if if you or someone you love is neurodivergent, be very careful about nicotine and caffeine, right? Because these are stimulants. But yes, Kim, I think that's something to ask Alexis or your doctor or your naturopath. Libby, my friend's daughters have been diagnosed with ADHD, and she uses an Apple Watch, which has been great, and they have an OT. Yes, some OTs are trained to do this ADHD coaching, like I mentioned. So, yeah, the Apple Watch is fantastic. My Apple Watch reminds me to do gratitude practice, mindfulness practice. The haptics with an alarm, and on my Apple Watch the alarm says, you know, go to shops, pick up whatever, because I think I have a little bit of an ADHD brain as well. And my best friend is a psychiatrist, and she has a diagnosis of ADHD. So I've learned a lot about it from her as well. Yes, ADHD is what you meant, Libby. Good. Well, speaking of these wonderful different brains that I'm surrounded with in my own household, I have to go and hang out with some of my neurodivergent family members now. I'll just say one more thing. When I did my training with Tony Attwood about 5 years ago, who is the world-leading expert on Asperger's, and Asperger's is not a term that gets used very much anymore. Well, it's not in the DSM anymore, which some people disagree with, but now we have autism level 1, 2, and 3. But Tony Attwood, who wrote all the books on Asperger's, who's from Brisbane, and he started Minds and Hearts in West End, which specialises in diagnosing and treating autism. He said at the training that I went to with him that he doesn't consider autism a disability, but a different ability. Now, I'm sure people with, say, level 2 or 3 autism, some of them would like to say, actually, I do have a disability. This really affects my abilities to do some things in life. But I don't think he was being dismissive or minimizing their struggles. But I liked this different ability rather than disability, because most people I know with neurodivergent brains, it's kind of their superpower. They do have really cool ways of looking at the world, really unusual perspectives on things. Sometimes the special interests, the talents, and the ability to be hyper-focused on their special interests and therefore develop amazing talents. My oldest is one of those, and I might post a photo in the comments that she did, a painting that she did recently. She's an amazing musician, and she's also an amazing artist. So when I jump off this call, I'll post a photo of a painting called The Dream Ravine, which she said was the combination of waking life and the dream world. And she got an A for it at school, because it's pretty amazing. So these different cool neurodivergent brains, if you have one or someone you know and love has one, then embrace this and make the most of it. And just keep learning, keep educating yourself. I think that's what we all need to do all of the time anyway. All right, well, yeah, I'll check back in at the comments later for anyone who watches this down the line a bit and answer any questions that people have later on. And next Sunday, I should be back again with Alexis. So stay tuned, and we'll let you know what the topic is that we're going to talk about next week. Until then, bye for now.